Hello and welcome to today's webinar on networking and advancing your career with mentors and advisors, which is part of CPHA's series on a career in public health, shaping your future. This webinar is being recorded. The Canadian Public Health Association is the largest, oldest, and most established independent public health organization in Canada. We currently have over 1,200 members, approximately half of which are students. We recognize that students in public health have distinct needs. For example, you might be interested in a career in public health. You may seek mentorship and networking opportunities with other public health professionals. You may be seeking additional sources of funding through student awards and bursaries. CPHA recognizes the needs of students and has tailored programs and services just for you. This 8-part webinar series is one such example. We've been offering the webinars since September 2016. They are geared for students and early career professionals and engage students on a variety of topics, including leadership skills in public health, to the range of jobs available for graduates with a degree in public health. So I'd like to take a moment now to get a sense of who we have in the audience with a few polls. So if you're at your computer, take a moment to let us know where you're based. So we've got pretty good representation from across the country, with the majority based in Ontario and a couple from Alberta and Quebec. Great. And what level of education have you completed? So mostly master's degrees, one MD, and a few bachelor levels. Great, thank you. 2 more polls. Are you a member of CPHA or the Public Health Physicians of Canada, or both organizations, or neither? So it looks like the vast majority are members of CPHA. Great, and I'll provide a link later on to where you can find more details about CPHA membership. Finally, how many years of experience do you have in the public health workforce? This will really help our presenter tailor some of her content. So a bit of a range of levels of experience, with some people having no experience, or 1 to 3 years experience, and then a few with a few more years experience. Okay, it looks like the majority are split between 0 and 1 to 3 years. So thank you very much. I'm just going to talk a little bit more about how this works. Currently, all participants are muted, and you will remain muted for the duration of this webinar. And you may use the comments section, however, to post questions and comments. And you also can update your status throughout the webinar using the options displayed under the drop-down of the person raising their hand. If we can't answer your question during the webinar, we will follow up by email. And as I mentioned earlier, the webinar is being recorded, and the recording will be made accessible to all CPHA members and registered webinar participants shortly following today's webinar. We will make the slides and recording more broadly available 3 months after the webinar. At the end of today's webinar, you will be redirected to a short survey. Please take a moment to send us your feedback. I'm seeing a comment that some person isn't hearing anything. If you could post in the chat area if you are able to hear me, please, that would be helpful, since the webinar started 4 minutes ago. Okay, I'm seeing some yeses, and based on the responses we saw to the polls, it looked like people were able to follow. So please ensure your volume you have your speakers turned on and your volume up. Okay, great. So I'll continue on here. And it is my pleasure to present today's presenter, Karen Dickenson-Smith. She has over 20 years of progressive experience in the public, private, and nonprofit sectors, including over 10 years in healthcare. She holds an MPH, MBA, and has a strong track record in strategy, healthcare management, and organizational change implementation. She is an avid networker and advocate for professional and career development. Karen brings many different perspectives to this presentation, including having been an employer of public health professionals, most recently and in her position as Fraser Health's Director of Clinical Programs for Population and Public Health, an MPH student, as well as a supervisor of public health practicum students, a mentee and a mentor in formal and informal mentoring relationships, and on the board of directors of a professional networking association, including 2 years as its president. So I will now bring up the presenter's slides and turn things over to Karen.
I'm going to assume that you can hear me okay. Welcome, everyone.
Yes.
In addition to what Emma shared about my perspectives, I believe very strongly in building the population public health workforce for the future. And I'm really glad to be speaking today with you, public health students and early career professionals, because you are the public health workforce and leaders of the future. And sharpening your practical skills like networking and leveraging mentors and advisors is an important way to help you advance in your careers while improving the public health workforce. So you've probably heard the saying, success happens when preparation meets opportunity. I presume that as public health students and early career professionals, you're bright, motivated, and capable. Opportunities are going to come your way. There's no doubt about that. My goal with this webinar is to share tips that will help your preparation. So you'll be able to increase the number of opportunities you're exposed to in your career, and you'll be better able to recognize them and know what to do when they happen. And I'll do this by covering these 3 topics. Before we dive in, we have another poll. Can you please answer this question on the screen? What is your comfort level with networking? And you can see the options there. Okay. Okay, so we've got some folks who are, not quite comfortable with it. We've got others who enjoy it but want to get better at it. Okay, great. Wonderful. Okay, so thank you very much. That helps me know kind of where you're at. So here are 2 standard definitions of networking that apply whether you're in public health or in any field. I'd like to draw your attention to 2 points. The first is in definition 1, where it says that networking remains the #1 cause of job attainment. Of course, you need to have the necessary qualifications and fit for a job, but networking does help set you apart. And the second point is in the second definition, and that is that effective networking is based on the question, how can I help, and not what can I get? It's an important distinction, and I'll talk more about that in a few minutes. First, we have one more poll. Oh. So this time, the question is, what is your biggest challenge with networking? And here I'm looking for one word or phrase. What challenges you about networking? Who to approach? Okay, yeah. Initiating, yeah, yeah. Okay. Describing what I do in a way that means something to other people, yeah. Okay, this is great. Okay, keeping their interest. So there's some themes here in terms of initiating the contact, and kind of how that approach works, and then how do you actually sustain it and follow up, and some logistical questions. Timing, when do you meet? Where do you meet? Yeah, okay, great. All right, so so having been an avid networker for most of my life, I've acquired a fair amount of experience and knowledge in that area, and I've distilled this into my top 10 tips, which are very practical. They're things you have control over that you can apply immediately if you want to, and they really touch on some of the challenges that you mentioned, which is great. Your challenges are fitting really nicely with what I've prepared here. So tip number 10 is to adopt a positive networking philosophy. So just like the previous definition you saw, positive networking means approaching with the attitude, how can I help? This term was coined by Darcy Rezac and the other co-founders of SHEPA Learning. It's spelled S-H-E-P-A. They have a fabulous website and a networking book called Work the Pond, as well as a free e-guide called The 7 Secrets of Positive Networking. If you haven't already, I highly recommend you check them out. As their book Work the Pond tells us, more than advancing your career, positive networking can help you make even more real contributions to society and to those around you. And you're mindful of the fact that many good deeds are reciprocated, but that is not your goal. Guy Kawasaki, who's a best-selling author, an Apple Fellow, and one of the top bloggers in the world, says that positive networking's "what can I do for you" attitude is the key to building extensive, long-lasting connections, and that once you get that, the rest is just mechanics. How this works practically is, so say you're connecting with someone, and it doesn't have to be at a formal networking event. It could be in a classroom or a bus stop or a hallway. When you're connecting with someone and you've established a rapport with them, think about how you can help them. If nothing helpful springs to mind while you're talking with the person and you think this is someone interesting who you might want to add to your network, make a note shortly after your conversation. What are they interested in? What are they challenged by? By keeping notes on the people that are in your network or you want in your network, you can share items of value with them. It could be a day or even a week after you've interacted with them, but you will make an impression by remembering and sending something helpful. Of course, you want to use your judgment and make it easy for them to use what you send. So you wouldn't want to email them a 40-page PDF with one sentence saying, "You'll really enjoy this." You want to make sure that whatever you're sending is likely to add value to their busy day. I have a story that involves me personally. So as a director of clinical programs in population public health for Fraser Health in BC, I was overseeing several community youth clinics. I met a young nurse educator at a meeting, and I told her about the youth clinics and how I had a lot of information from the literature and from healthcare providers about how well our service model was meeting best practices, but I hardly had any information from the youth themselves about their experiences with our clinics. Less than a week later, this young nurse educator sent me an email with a web link for a nonprofit organization called Viper, which works with youth in the Fraser Valley, which is where our youth clinics are located. Viper has coordinators who survey youth to get their perspectives on all kinds of topics. The nurse educator wondered if they would be able to add Fraser Health youth clinics to their list of topics to survey the youth about. Now, I doubt that this nurse educator knew that she was practicing positive networking, but that is exactly what she was doing. She listened, she followed up to send me a resource, and she didn't just send me a link to Viper's website and say FYI. She connected the dots and suggested a helpful idea. A while later, I was on the market for a project lead for a youth clinic initiative, and long story short, this particular nurse educator ended up in the position. Of course, she had the required qualifications, capabilities, and motivation, and she expressed interest in the position, but she also stood out because she had practiced the art of positive networking. So I encourage you to try it, and you'll be amazed at what can happen. So tip number 9 is getting clear on the value that you bring. What is unique to you that most other students and or early career professionals in public health are not likely to have? Sketch this out for yourself and have it at the forefront of your mind when you're out there talking with people in networking situations. Have some possibilities in your back pocket that you can pull out depending on the needs and interests of those you meet. It could be that you have really good skills with social media, or you have a knack for GIS mapping, or there's an innovative idea that you have for solving a public health problem. Some people think networking is sleazy or fake, but honestly, it really depends on your mindset. This tip is about changing your mindset so that when you're out there doing your positive networking, you are objectively seeing your own skills, knowledge, connections, and ideas as items of value that can help other people, depending on what their needs are. If you possess something that could benefit someone else, you're not being self-serving or sleazy by offering it. You are contributing something of value. So be honest with yourself about what you bring, and be like a detective when it comes to what other people need. And if you're not sure what they need, ask clarifying questions. The sweet spot is when there's a match between the needs of others and your own skills, knowledge, connections, or ideas. So tip number 8, this is about creating your personal elevator pitch, or what I like to call my stair pitch, because I prefer to take the stairs whenever possible, and I am constantly talking to people on the stairs. This is a brief, less than 30-second summary of who you are, what you're seeking, the value you contribute, what makes you unique, and why people should care. And this is all, of course, in the context of your career in public health. The infographic on this slide shows a good flow for a pitch, and you'll want to practice your pitch often so it just rolls off your tongue. So I have a sample pitch for you, and this is one for Rob Smith. Hello, I'm Rob Smith. I just graduated from the UBC Master of Public Health program, and I'm looking for an analyst level job in public health, ideally involving surveillance and data analysis. Last summer, I completed my practicum with the BC Centre for Disease Control, where I worked on a serious outcome surveillance system for emerging communicable diseases. I have strong skills in data analysis, health assessment, and disease surveillance, and I'm really good at synthesizing data into usable reports for decision makers. As a follow-up to his elevator pitch, which is really short, Rob would pause and see if the employer he's talking to has any questions or comments. Rob allows the conversation to go in the direction of the person's interests. He doesn't think that a brief silence on the part of his audience means that he needs to fill the void with lots of information. He pauses, waits, and takes his cues from the employer he's speaking with. I would say that this is a top priority tip for students and early career professionals. When we're just starting out, we typically have so much enthusiasm, and we want to share all about ourselves and make a good impression. And even if we're not that comfortable talking about ourselves, sometimes opportunities to speak directly with hiring managers are few and far between. So we think we need to seize the moment when these opportunities do happen and tell this hiring manager everything that could possibly put us in the running for a job opening. But I can tell you that is probably the worst thing that you can do. If you provide way too much detail, you will lose your audience. So give them your concise elevator pitch, and then let them tell you what they want to hear more about. Trust me, this will really help you to be more effective in networking conversations. And it's not just conversations with employers. This approach also works with mentors and advisors, which we'll talk about more later, volunteer organizations, and more. Tip number 7. So you are all presumably bright young things, and in the quiet of your homes, you probably do an excellent job of articulating the answers to common career questions. What you might need to practice is responding briefly and confidently to these questions when you're talking with people you don't know that well. And that came out in some of your challenges that you identified. So when you're in a networking situation, many times I've been talking with a student or an early career professional, or I've observed them talking with someone else, and the conversation's going really smoothly until a career-related question is asked, often one of the ones on this slide, and the student/early career professional suddenly becomes a deer in headlights. Now, we've all been there, myself included. It's not fun. You know the answer, but you haven't really prepared to deliver it quickly and confidently in this type of forum. You might stammer or stumble. Usually the person you're talking with, they either take pity on you and they change the subject, or they walk away. And I have so been there. And of course, no one can prepare for every question. That would be impossible. But I've provided some common ones that can easily trip us up, especially when we're a little newer to networking. This isn't an exhaustive list, and you may have other questions that you know you'll be commonly asked depending on your area of public health or your network. The key is to prepare. So remember what I was saying about, that quote, success comes where preparation meets opportunity. Prepare solid answers to what you think will be your common questions and practice delivering them so that when you do get asked, you don't freeze up and miss the chance to make a good impression. You can practice with your friends, your significant other, your pets, whatever works for you. My personal theory is that many bright, motivated, capable young people are excellent matches for career opportunities in public health, but sometimes they don't get identified as a good fit because they're missing the preparation outlined in my tips, particularly this one. Tip number 6, this may seem to go without saying, but it actually relates to a frequent faux pas, and especially with young, eager, type A students and early career professionals, not just in public health, in other industries too, especially industries that attract high achievers. There's a tendency to miss cues from the people around us, which can result in us unintentionally alienating the very people that we may be trying to impress. Sometimes it's nerves and thinking that you need to fill the silence with talking. If you find yourself in this situation and you're not sure what to say that's going to have a positive effect on the conversation, ask questions. You can start with small talk, such as, do you come to these events often? Tell me about your role in your organization. Some of you were asking, how do you initiate the conversation? These are really good conversation starters. And if the person is interested in sharing, ask them some follow-up questions about themselves. Everybody has a story, and often people like it when others show interest in them. I have a story about actually an unfortunate situation, but I was at the Canadian Health Leaders Conference once. And by the way, this is a great networking opportunity where leaders from all areas of health, including public health, gather to connect and learn. If you haven't yet attended, I would highly recommend it. But anyways, during lunch on one of the days at the conference, I was seated at a table with about 10 health leaders, including the vice president of a provincial agency. I happen to know this VP, and they're in my network. The entire table was engaged in a light, relaxed conversation about outdoor activities, so not work-related at all. Some were sharing stories about hiking, others about running or skiing. In the middle of this relaxed conversation, a young professional seated near me suddenly realized he was sitting at the table with a vice president. He abruptly interrupted the group conversation and said to the VP, "Hey, you're the vice president of this provincial agency." The entire table stopped talking. In the awkward silence that followed, this young professional started to detail his entire resume, from volunteer activities in high school to his university education and the jobs he had held in the few years since graduation. The VP and the rest of the table listened in stunned silence. And the young professional continued with a very serious tone, never pausing to take a breath, and oblivious to the effect he was having on the atmosphere and the people around him. The VP listened politely for a while and then got up to go to the bathroom, never to be seen again. Now, that's an extreme example, but it actually happened. And a key takeaway message is pay attention to the cues. Read your audience, listen more than you talk, and adjust based on the reactions and interests of others. Tip number 5 is to start networking early, ideally while you're still in school. School is a really safe place to make connections, to practice positive networking, and to build your skills and confidence. And I would assume some of you guys are in school based on your responses to your work experience poll. The Shepa Learning Company that I mentioned earlier has a wealth of helpful resources, and many of them are free online from their website. They have a special networking guide for students, a LinkedIn networking group that's aimed at helping you find a job, and weekly networking tips that you can sign up to have delivered to your inbox for free. There are also many nonprofit associations that are dedicated to helping early career professionals network and develop. The CPHA, as you probably know, that's hosting this webinar series, has a student corner on their website. They offer volunteer opportunities and special student networking events at their conferences. And they also have a LinkedIn group for students. There are even networking associations specifically for women. The Downtown Networking Association and the Canadian Professional Women's Network are examples. So ask around, find out what associations exist in your community, and you might want to consider joining Toastmasters or another public speaking group to build your confidence talking with people you don't know. And this again links to the initiating conversations that some folks mentioned there is a challenge. You might want to consider taking a leadership role with your peers and invite your fellow students or colleagues to attend with you. Tip number 4 is to cultivate your professional social media presence, including a LinkedIn profile. With LinkedIn and any other aspects of your online presence, you'll want to make sure that you incorporate clear links to public health. If you're applying for public health jobs and you're looking to advance your career in public health, when people view you online, they should easily see how you are or would like to be contributing in public health. So make it really easy for them to see that connection. Stay on top of new developments in social media and be diligent about removing anything that's online about you that could be deemed unprofessional. Tip number 3 is to think critically and strategically about who you are networking with. Instead of always networking with people your own age or all people in public health, broaden your horizons, and this will maximize your exposure to different types of opportunities. You'll want to interact with new people on a regular basis, and you might want to consider setting a goal for yourself. For example, to meet one new person a week. They could be a new student in one of your classes. They could be a new person in a volunteer organization you're involved with, or a new person in your workplace. And another concrete example of something you can do is next time you're at a conference or a workshop or event, sit and talk with people you don't know. It sounds really simple, but hardly anyone does it. And not just people who are early in their career, but all through their careers. Talk to people you don't know, practice active listening and positive networking. Why sit with the same people you see every day who you can easily connect with when the conference or workshop is over? Instead, spend your time getting to know the people who come from different places. And finally, be easy to reach. I know in this day and age, younger people don't tend to carry business cards. If you're not going to carry them, make sure you've got a quick and easy way to give people your contact info, like airdropping, for example. But keep in mind that not everyone is going to be familiar with or comfortable using technology in that way. So you may want to carry some business cards with you just in case. Tip number 2 is really about knowing yourself and your networking preferences. Consider what's listed on this slide to determine the networking frequency, focus, energy level, and timing that works best for you. There was a question about, where should you network? Or so reflecting on this for yourself will help you see what networking environments you're going to be your best in. And the final tip, number 1, is to create your personal networking plan. We know that when we actually write things down and be specific, we're more likely to follow through. So once you've thought about and practiced the other 9 tips, get on your computer and create a plan for yourself. You'll benefit from a networking plan regardless of whether you currently have a job in public health. Even if you're not looking for a job, you should be involved in some sort of networking. You always want to be cultivating and sustaining your network. And actually the best time to network is when things are going well for you career-wise, because you'll be better able to focus on helping others. So to create your personal networking plan, you want to first reflect on your current career goals and priorities, and then reflect on the considerations on this slide to pull together your plan. One point is that to make it easier for you to contribute to the many different types of networking conversations, you'll want to stay up to date on current events and what's happening in your local community. And you especially want to make sure you're up on what's happening in public health. And ideally, you link that with what's going on in the news. So make this a priority and actually write it into your plan. So now we're going to cue a video, and afterwards a heads up that I'll be inviting any questions or comments you may have about networking. This was a clip on what not to do.
So, what do you do?
Nothing. I describe myself as a fast-talking go-getter with years of customer service experience and a real yearning for dedicated passion.
I describe myself as a fast-talking go-getter with years of customer service experience and a real yearning for dedicated passion.
Your hand. Hey Sam, I'm thinking about going into marketing, so I was looking for some internships or some work placements. If you hear of anything, that'd be really cool. Oh, free bar! Network me! Let's be real, I never loved him. I'm Stevie, and we're networking now! Good! Oh, little shit.
So why do they call it networking when it's so much fun? Oh.
Okay, so while we're closing out of the video, you can start entering your questions in the chat box.
We've had a couple already posed in the comments. One question, if you have any suggestions on methods or tools for keeping notes on people. You mentioned that early on in your top 10.
Oh, okay.
Yes, keeping notes on people to follow.
Oh, sorry, on keeping notes? Oh, okay. So I've used LinkedIn for that, where you can put notes on your connections profiles. And I've also used OneNote, just a really simple method, and Outlook contacts. So those are 3 methods that I've tried over the years. I think it's more about finding, so whatever is the system that you use, to keep track of your contacts. So whether it's on your phone or on your computer at work or whatever, using that system that you're already regularly interacting with to put those notes about your contacts, you're going to be more likely to actually use it. Okay, that's fine. I think it's just getting as clear as possible about the more specific, put it this way, the more specific you are about what you're looking for and what you bring to contribute to that type of role or area, the easier it's going to be for the person you're pitching to help you. So you want to be as clear as you possibly can. And you know, if you haven't narrowed it down and you are looking at a very broad area, you can just state that. But ideally, you've narrowed it down a little bit in terms of even the level of position that you're seeking. You know, the types of skills that you would be using in the particular area. So try to be as specific as you can. And I've included a number of prompts on the slides that you can go back and look at and see, think about it and see if you can narrow it down a little bit more. If you're absolutely not able to, then just state the broad area that you're interested in, and then what's unique to you that's going to help you add value to that area of public health.
Great.
Okay, that's a really good question, and we will, I'll cover that in the next couple of sections of the presentation. So if you wouldn't mind just holding on to that thought, and we'll talk about it in a few minutes. Any other questions? Okay, great, thank you. Okay, so my second topic is finding and sustaining mentors. So this directly relates to the question that we just had. So a quick poll. What is your biggest challenge with finding and sustaining mentors for the purpose of advancing your career in public health? They're too busy. Yeah. Yeah. Yep. Keeping in contact after a couple of years. Who to approach. Ignored when you reach out. Okay. They're not in charge of hiring. Sustaining after you leave an organization. Finding someone who's in your area of interest. Okay. Okay. So kind of a theme around sustaining the mentoring relationships and finding them in the first place because they're busy or it's hard to, you know, find somebody that's a good fit. And then a few about hiring. So I would assume using mentors to find a job. Okay. Ego was interesting. Okay. All right. Okay. So thank you very much for your challenges, and I'll do my best to address them as we go along. So first of all, you may ask, who are ideal mentors? And this relates to the challenge that some of you mentioned about actually, you know, finding people in the first place. So these are my descriptions based on what has worked for me. I find it helpful to distinguish between longer-term career mentors and shorter-term mentors who are helping you learn a specific skill or a public health job or a content area. And on this slide are some key points about each type of mentor. Longer-term mentors are less and less common as careers become more varied and less linear. I'm told by my HR colleagues that these days it's not unusual for someone to have 11 different jobs in the first 10 years of their career. And so therefore it's become less realistic to expect that you're going to follow in the footsteps of just one person for years and years. However, I left that longer-term mentor description in because even today there's some people who know absolutely with 100% certainty that they want to become X. For example, a medical health officer, a public health researcher, a public health nurse, and they want to dedicate their entire career to that. It's becoming more and more rare, but it does still happen. And if you are in that situation and you're wanting a longer-term career mentoring relationship, you first will want to have a sense of your career goals, style, and strengths. And if you haven't already done this, I highly recommend investing the time. I've included some links to online resources at the end of my presentation that you can go and check out. And it's actually a really good idea for everyone to do, regardless of what type of mentor you're seeking. For the longer term mentors, you also want to have a sense of the style and strengths of your potential mentors. And that means you'll want to invest some time in learning about each prospect, because ideally for the longer term mentoring relationship, you want someone who's fairly similar to you in strengths and style. For the shorter term, that are more job or content or skill-based mentors, those are very common today, and those are on the right-hand column of the slide. You'll want to have a sense of what skills or public health jobs or content areas you want to learn more about based on your career goals. And again, the more specific you can be, the easier it's going to be for potential mentors to respond and engage with you. Most modern day mentorship programs are set up this way, where mentees are matched with mentors who are working in a specific content area or a job. For the skill-based mentoring, you'll first want to assess a prospective mentor's level of expertise in a skill area. So this involves doing your homework, because you don't want to waste your time and theirs. And how you can do this is ask around. You can do internet research on the person, also ask people who have worked with him or her, kind of like a detective again. Finding and approaching mentors, which many of you had mentioned as a challenge. So once you've done your homework and you've identified possible short-term mentors, decide how you're going to approach them. Now, this is much easier if you're using a formal mentorship program, because they usually help facilitate that process for you, at least in the beginning. But if you're doing this on your own, and if you don't know the person, it's best to connect through somebody who has them in their network. So it could be a friend of yours, a colleague, somebody in your network who has that mentor in their network. And this is actually ideal. So you would want to approach that person and say, can you please connect me with this person? I'm interested in learning about a job or a content area or a skill. Remember your elevator pitch. So this is where you can use it again, this time tailored specifically for your prospective mentors. I would actually recommend using your elevator pitch even if you're in a formal mentorship program. In this case, you're not trying to persuade the person to be your mentor, but you'll probably save a lot of time and accelerate your relationship by clearly and succinctly outlining your goals and what you bring. And of course, once again, you're going to pause after you say your pitch, and you're going to listen for the person's response. You know, especially if you're trying to persuade them to be your mentor, you really want to listen and pick up those cues from them and be open to adjusting your idea for what the mentoring might look like if your prospective mentor has different ideas. And if they don't happen to be interested, I know someone mentioned, you know, they don't get a response or whatever the case may be, don't take it personally. You're right. A lot of, especially senior leaders, are extremely busy. Say thank you for considering it. And also ask if they can recommend someone else from their network who would be suitable to help you learn about that particular skill or public health job or content area, because chances are they have someone in their network who could help. So always ask that question, even if you get a no or no response. Okay. To sustain these mentoring relationships, again, a number of you were asking about this. And remember, these are typically short term. So we're talking about days or months versus years. A lot of this is the work you do in the upfront. So you want to agree upfront on what you want to learn about and how they will help you. You also want to agree on the logistics of your interactions and roughly when the mentoring will end. You want to document your agreement somehow. And, I'm not talking about a 20-page legal document, but a few sentences in an email will do. And this will help remind you and your mentor about the goals and scope of your relationship. You want to listen to what your mentor tells you and follow up. Obviously, you want to keep confidential anything that they share with you in confidence. And say thank you. And during the mentoring relationship, if you're finding that the guidance that you're receiving is not really helping you, or you're not really acting on their suggestions, raise it and talk about it. Don't just ignore their suggestions. And if this persists over time, you want to consider whether you should respectfully close off the mentoring relationship. And if you do decide to go that route, of course you want to be respectful and positive, thank the person for their time and input. You also want to keep them in your network. And where possible, you want to contribute something of value to them. So remember, we talked about positive networking and keeping those notes on what people are interested in and what they're challenged by. You want to refer back to those notes, even if you're no longer working with the person, you're no longer involved in a mentoring relationship. People and circumstances are always changing and evolving, so you don't want to burn your bridges. And you want to keep the communication lines open. And I'm not talking about, contacting them every week or anything like that, but, maybe every 6 months or even once a year, find an opportunity to contribute something of value to that person. So my final topic is about creating and sustaining your career advisory board. I mentioned that longer-term mentors are becoming less and less common. And today, instead of turning to 1 or 2 mentors for career wisdom, more and more people are designing their own personal career advisory boards. And what follows on the next few slides is my view of what constitutes an effective career advisory board. There are many different approaches and models out there. This is one that has worked for me. So your personal career advisory board is a small group of people that you select to provide candid, useful advice on specific career-related issues that you bring to them, often over a period of years. Your advisors may not even know one another. They interact with you through an agreement to provide you with career advice at specific milestones. Some examples of career milestones are finding your first job after graduation, preparing for a critical job interview, choosing between different career opportunities, or possibly even navigating a difficult political situation. The point is that you decide what you want to bring forward to your hand-picked advisory, and you seek their advice on significant events in your career. So how do you identify and approach your potential advisory board members? Again, this is what has worked for me. So do some thinking. Think about who's in your network or who you would like to be in your network, and identify no more than around 8 professionals. I have some considerations for who you would want to pick on this slide. Usually this is not your best friends or family members, although in rare cases, if you have a brutally honest, non-emotional relationship and they have the required expertise, it can work. But usually your advisors are people in your professional sphere. Ideally, about half to 3/4 of your advisors will be working in or have previous valuable experience in public health. But you'll also want some advisors from other fields because they will bring different perspectives. And once again, when you're approaching your prospective advisory board members, you want to use your elevator pitch, tailored for this purpose. how do you sustain your personal career advisory board? So you're going to periodically seek advice from them at key milestones. You want to reassess who's on your board and how you're performing based on their advice. And as needed, you're going to change it up based on your current goals and the results that you're getting. Some people recommend bringing your entire advisory board together at the same time, but I have never pursued this myself for a couple of reasons. First of all, people's time is precious, as some of you mentioned. No one's out there looking for another meeting to attend. But also, I found it really effective to ask for advice one-on-one, over coffee or whatever's easiest for the person I'm seeking advice from. And in doing so, I build those individual relationships. But that's not to say that you wouldn't want to try bringing the group together. I just have chosen not to do that.
Yeah, so we have a couple of other questions.
So here are some additional resources that you can look at on your own time. This PowerPoint will be posted on the CPHA portal for you to access later. And now we're going to pause to invite any more questions or comments. I'll rely on Emma to help me read them there.
Yeah, so we have a couple of other questions. Georgia is wondering if you can explain the difference between mentor and coach.
Oh, okay, good question. So a mentor is somebody who has a job, a skill, or a content area that you want to learn about or develop, in the case of the shorter term mentors. Or they have a career that you aspire to have for yourself. So mentoring is when you're kind of following in the person's footsteps. You're learning about what they know. You're benefiting from their wisdom and their experience so that you can do something similar. With coaching, coaches are more neutral, and they are there to help you get clear on what you want or what your goals are. So they're sort of a neutral person who is helping you probe into career aspects that are going to be helpful for you. So the coach has not necessarily been in a career or held a job or a skill that you want to learn about. Typically, a coach is a neutral, neutral support for you. So I hope that makes sense.
Another question from Shannon about resources for a mentorship program. And in fact, Shannon, we're going to be revealing that CPHA is about to launch a mentorship program, and we will be supplying.
So if you don't know anybody in the specific area of public health that you're interested in,
Karen might have a few to mention right now, but that's something that we can.
Okay.
Again, just to reiterate the question.
Okay.
Karen, Shannon is wondering if you have any suggested resources for the development of a professional mentorship program.
A mentorship program. And we're going to be revealing that CPHA is about to launch a mentorship program, and we will be supplying resources. And invited Karen to suggest some resources, and Karen might have a few to mention right now, but that's something that we can certainly follow along with. So again, just to reiterate the question, Shannon is wondering if you have any suggested resources for the development of a professional mentorship program for a public health organization.
So if you are a public health organization and you're looking to develop a mentorship program?
Yeah, that's great. Thanks. Okay.
I just want to make sure I'm clear on the question.
What if I'm interested in meeting a mentor outside?
Well, I think you will, and that's kind of maybe another conversation, and I'd be happy to connect offline with you, Shannon, as well. That might be the best way to handle that one because it is a little more, a little outside of the scope of today. Would that be okay? Okay, perfect.
Yeah, that's great. Thanks. Okay. Another question coming in. What if I'm interested in meeting a mentor outside of academia? I'm invited to a conference with policymakers in May, but I'm only ever spoken with professors and research coordinators.
So how do you prepare to talk with people outside of academia? I'm guessing?
Exactly.
Yes. Okay, perfect. Okay, so that's where you want to really practice some of those earlier tips that I mentioned. So you want to really go in with a positive networking mindset, and you want to be really clear on what value you bring in really plain language. So not in academic language, but in plain words. And make sure that your elevator pitch is also in plain language, because you can't guarantee that the folks you're going to be talking with are going to understand the particular research terminology or the terminology of your specialization. Okay, that's really important, that your elevator pitch be really clear, plain language, that pretty much anyone can understand. Because even if you're talking to a senior leader in public health, it may have been a long time since they were in school, and they might not be completely up on specialized terminology that you're learning. And so you want to make it as easy as possible for people to understand you and your value.
Okay, I think we have time for one or two more questions. So just to go back to that earlier question, if we don't know anyone, we got some clarification that, what if we don't know anyone in public health near us?
Okay, so I'm assuming that you know people in public health somewhere. So I guess I'll answer based on that. So what I would recommend is using whatever contacts you do have in public health, even if they're in a different country. They're still, we're more and more increasingly global. So I would actually ask the question of your connections in different parts of the world or parts of the country. Again, give them your elevator pitch and say, this is what I'm interested in learning about, and I'd like to meet some people who are in this particular area of public health, and here's why I want to do it, and here's what I bring. And ask them to connect you with their contacts in their network. That is actually the best approach to take, because then you're being connected by somebody who already knows these people in the public health network. It just brings a lot more credibility than contacting somebody out of the blue.
I'm so sorry that I'm going to have to cut off the discussion now, and I'm going to post Karen's email address for anyone who wants to follow up with her directly. We will also try and respond to all those individuals who asked questions that we didn't get to on the call. So thank you so much, Karen, for such a fantastic presentation. You really provoked excellent discussion, and we really appreciate it. I have some exciting announcements, like I mentioned. First of all, registration is now open for the last webinar in our series. It's happening on Tuesday, April the 4th, same time, same place. The topic is public health and practice, and we've got 3 presenters with really diverse backgrounds from different careers in public health. We have medical officer of health, a nurse, and a public health inspector, so you don't want to miss it. And like I mentioned, CPHAs, we are about to launch our very own mentorship program for members of CPHA. We'll be launching by early next week. And if you are a member, then you are eligible to apply, and you'll have to fill out a very short form, and we will match you with a more established public health professional. And we're very excited to see this program happening. So if you're not a member of CPHA yet, then please consider joining. The link there is posted, where there are several other benefits of being a member as well. And I also just want to, in case it's not already in your calendar, I want to let everyone know about our upcoming annual conference. This year it's happening in Halifax, June 6th to 8th, and there are several student and trainee events. This is a fantastic networking and mentorship opportunity. And finally, a little bit more about what we do at CPHA. We're a policy and advocacy organization, and some of our recent topics are around the opioid crisis, cannabis regulation. We are looking into environments and health, and early childhood education and care. So I'll leave you with some key contacts at the organization, and we'd be happy to hear from you. Thank you all for your time and for joining today. Have a great rest of the day.